How safe are eye injections? This is Dr. Anina Abraham from Advanced Retina Care, Hyderabad. You have probably heard many people talk about injections given inside the eye, and patients have lost their vision or become blind after the injection was given. Before that, they had good vision, and after the injection was given, they have lost their eyesight completely. Now, these things are extremely rare. Losing your vision following an injection is extremely rare. The only condition where it can actually happen is something called endophthalmitis, where the drug itself is contaminated. And if the improper drug or contaminated drug has been injected into your eye, yes, there is definitely a chance of endophthalmitis or pus forming inside the eyeball. As a result of this, there's a tendency to lose vision if not treated immediately and appropriately. Even an endophthalmitis can be treated if the appropriate antibiotics are given at the right time into the eye can be saved. It's very rare that the eye is actually lost because of an endophthalmitis. Apart from this, if the technique of giving the injection is not correct, it is possible to have an increased cataract. It is possible to have retinal tears and retinal detachment. But again, these are very rare. If the doctor knows exactly where to give the injection and if the patient is cooperative, normally there should not be any such problem. We know that this injection is injected 3.5 to 4 millimeters from the limbus, which is the junction between the cornea and the conjunctiva, and that's where this injection is given. So if it is given like this and perpendicularly with a good needle straight into the vitreous cavity, you should not be having any complications because of this. There are injections like steroids which can be injected into the eye for various conditions like macular edema. The problem with steroids is sometimes they can cause very bad floaters, and it can cause a rise in intraocular pressure. It can increase your cataract. These are some of the risks of intravitreal injections with steroids. However, there are some conditions which respond very well to steroids, and steroids must not be withheld just because of those possible complications. Very rarely, some drugs can also cause a lot of vitreous haze and some other issues which are extremely rare. So more or less, the benefits are much higher than the risks of giving an injection inside the eye.